Hello, today I will tell you 10 important facts about speed. The first red ribbon fact. The red ribbon is a symbol of support and awareness of HIV/AIDS. It was first used in 1991 when a group of artists and activists created the symbol in response to the spread of the HIV/AIDS epidemic. The red ribbon has become a global symbol of solidarity with those living with HIV/AIDS and symbolizes support for the prevention and treatment of the disease. It is also used to draw attention to the stigma surrounding HIV/AIDS and those living with the disease. The red ribbon is actively used at events aimed at raising awareness of HIV/AIDS and is an important symbol of the movement to combat this epidemic. Next fact, disease resistance. Perceptions of disease vary depending on the individual, their immune system status, and other factors. There is a certain group of people known as non-standard HIV controllers who are able to control their viral load without treatment. This indicates that each person's immune system responds to HIV differently, and in some cases may be highly resistant to the disease. However, these special characteristics of the immune system are still being studied, and they do not mean that a person with this condition cannot transmit HIV to other people. It is therefore important to continue to take protective measures, even if the immune system appears to be resistant to the disease. Next fact, First Name. First Names is a global initiative that was created to express support and solidarity with people living with HIV/AIDS, as well as to raise awareness and understanding of the disease. People from all over the world join the campaign by adding the word first name to their name on social media profiles or other platforms. This is a symbol of support and is celebrated during the International AIDS Day, which is marked annually on December 1st. This action helps to draw attention to AIDS-related issues and reduce the stigma that often accompanies the disease. Next fact, the most studied virus, HIV. Human immunodeficiency virus, the causative agent of AIDS, is one of the most studied viruses in the world. This is due not only to its serious health consequences, but also to its widespread distribution and global public health threat. For decades, scientists have been studying its mechanisms of action, structure, and transmission methods, as well as developing treatment and prevention methods. This allows us to understand the virus better and develop more effective strategies to combat it, including vaccination, education, and access to antiretroviral drugs. Next fact, transfer. HIV transmission can occur through a variety of routes, including sexual contact. The most common way to transmit HIV is through unprotected sexual contact with an infected person. Blood. Transmission is possible through the sharing of unsterilized syringes and other instruments that may be contaminated with the blood of an infected person. Vertical transmission. An infected mother can pass HIV to her infant during pregnancy, childbirth, or breastfeeding. Drug use. Needle sharing and drug use can lead to the transmission of HIV through the bloodstream. Blood transfusion. In the past, before modern safety standards were put in place, it was possible to transmit HIV through the transfusion of infected blood. However, now blood is usually subjected to strict HIV testing procedures. The next World AIDS Day fact. World AIDS Day, which is celebrated annually on December 1st, was created to draw public attention to the problem of HIV/AIDS, raise awareness of it, and support people living with the virus. It is an international day of remembrance for those who have died of AIDS and support for those living with HIV. The first World AIDS discussion was held in 1988, and the first World AIDS Day was celebrated on December 1st, 1988. Since then, this day has become a time for the global community to express support for people living with HIV/AIDS and discuss measures to prevent the spread of the virus. Each year's theme includes different aspects of the problem, such as diagnosis, treatment, support, and prevention. The day is also marked by the red ribbon symbol, which has become an international sign of support for the fight against HIV/AIDS. Next fact, the virus can live for 10 years. This fact is not true. The human immunodeficiency virus, HIV, cannot live on its own outside of the host body. Outside the human body, HIV quickly loses its activity and ability to replicate. It can survive on the surfaces of objects or in the environment for only a very short time. The infectious activity of HIV usually decreases to zero very quickly after it leaves the human body. Therefore, it is important to remember that HIV transmission occurs exclusively through contact with infected blood, secretions, or semen, and not through the external environment. The following fact is that HIV infection is curable. This fact is true. HIV infection is a tachyonemic disease and is now well controlled through antiretroviral therapy, ART. People with HIV can take ART medications that help maintain their immune health, prevent the development of AIDS, and allow them to live a long and active life. ART improves the quality of life and allows people with HIV to lead a normal life, develop a career, plan a family, and fulfill other goals. However, it is important to start treatment as soon as possible after HIV diagnosis to achieve the best results. The next fact is that HIV is very flexible genetically. This fact is true. HIV is very flexible genetically, which means it can mutate rapidly, making it difficult to develop an effective vaccine. Mutations in the HIV genome allow it to evade drugs and vaccines and change its structure, making it more difficult to treat. This makes HIV one of the most dangerous viral infections to treat and control. The next fact is that 33 million people are living with HIV. This fact is true. According to the World Health Organization, as of 2020, an estimated 37.7 million people are living with HIV worldwide. This is a serious public health problem, and efforts are ongoing to prevent the spread of HIV and to ensure access to treatment and support for people living with HIV.